everyone, I'm Smarika and I welcome you all to the session of Community Health Nursing. We are going to start with the very first unit today, which is Introduction to Community Health Nursing. And in this session today, we are going to see what is community, what are the different elements of community, what is health, what is community health, and what is community health nursing. Before we go and understand what is community health nursing, first we have to understand what is a community, what is health, and what is nursing. So what is a community? A community can be described as a group of people living in the same geographical area. So when we have a group of people who are living together in a particular geographical area, we consider them as one community. Community is believed to have a certain kind of impact or influence on the health of the individual. What kind of community I belong to or what are the health beliefs of my community also influence my individual health. As community health nurses, we need to understand the structure of the community. Now, why is it necessary for the nurses to understand the structure of the community? It is necessary for nurses to understand the structure because the planned action will only be effective if the nurses have proper idea about the chosen community. Before we go on and read about what is community health nursing, as I said, we need to understand the concept of community. We need to understand what is community health, and then we will see what is community health nursing. As I already said, a community is a group of people who are living together in a particular geographical area. So group of people who come together, live together in a particular geographical area. They have common kind of interest and they also share common culture and tradition. The word community has been viewed by different authors from various perspectives. That means different authors have different kind of perspective about the term community. The term community can be given to a group of people who are living in a certain geographical area, and some author also believe that the term community can be given to people who share common subcultures as well. Now let us see what are the various characteristics of a community. The first characteristic of community is group of people. So as we have been seeing from the definition, when a particular group of people stay in a particular geographical area, they are termed as a community. So a group of people is one of the characteristics of a community. One individual or two or three individuals cannot be termed as a community. There should be a group of people to be termed as community. The second feature of a community is common place. So we have already seen in the definition that a group of people living in a particular geographical area, living in a same geographical area, can be considered as community. So the first one is group of people, the second one is common place, the third one is interaction among members. So in a community, members interact with one another, they communicate with one another. Another feature of community is they have common culture, and another feature of community is that they also have common language. And the last two feature of a community is that more or less people in a particular community have similar kind of lifestyle and they have common values and interests. A community is a term that can be used for a group of people who are living in the same geographical area. So this includes the features as well. A group of people living in the same geographical area, more or less having similar kind of culture, similar type of lifestyle. They interact with one another, they have common culture and also common language. So these are the features of a community. The community is a social system where the members within the community interact with one another. So a community can be defined as a group of people who are living in the same geographical area and the members interact with one another. They communicate with one another between the community members. There is another view of community that has been given by an author called Saunders, and he says that community can be viewed basically by three things, or the term community can be given to people by three of these features. The first feature is group of people. So if there are group of people, the second feature is a common place. Common place means sharing same geographical area, and the last one is a social system where there is interaction among the members in the community. So Saunders believed that a particular group of people can be termed as community when they belong to a same place, when they live in the same geographical area, when they communicate with one another within the group, and when there is a group of people. I hope you've understood what community is. As nurses, we must have the knowledge of the demographic characteristics of a population, the health status of the community, and all the health resources that are available within the geographical area. As nurses, we must know the geographical characteristic of the particular population. We must also be aware about the health resources that are available in the community and the health status of the people living in the particular community. Along with having this basic data about the population, nurses must also have a proper idea about the values, cultures, belief, feelings and lifestyle of the people within the community. And as nurses, we must also be aware that all of these features differ from one community to another. So as nurses, even though we work with several different communities, even though every different community will have different belief, culture, tradition, different lifestyle and attitude, nurses must have a proper understanding while providing care to the particular community. Now that we've understood what is community, let us see what is community health. Community health refers to an overall health of the people in the community, that is the physical, mental, social and spiritual well-being of the individuals in the community. World Health Organization have said that community health can be promoted, it can be prevented and maintained with a proper collaborative effort of healthcare professionals and the community people. So those healthcare professionals who are directly involved in providing healthcare services to the community and equal participation from the people in the community will lead to a proper or a good community health. It can help in promotion, preservation and maintenance of health of the community. So from this sentence, we can understand that for a good community health, in order to maintain a proper community health, we need the effort from the healthcare professionals who are rendering the care to the community people, as well as equal participation is required from the people in the community. So what is community health? Community health is the optimum level of functioning of the individuals in the community. So community is obviously comprised of different individuals. So each of the individual must have a well-being. They must reach a state of optimum well-being to be considered as a proper or a good community health. So all of the individual involved in the community must have optimum level of well-being, must have optimum level of good health in order to be considered as a good community. Let us now see what are the goals for achieving community health. The first one is to decrease the morbidity and mortality rate. So by decreasing the morbidity and mortality rate, we will be able to obtain optimum health in the community. To decrease morbidity and mortality rate is the first goal for achieving community health. Second goal for achieving community health is to increase the lifespan of an individual. Let us now see how can we achieve community health. So there are various ways through which we can achieve community health. The first thing is providing a safe environment. So providing a safe environment for the community people so that they can stay safely in that environment without acquiring any disease is the first way through which community health can be achieved. The second way through which community health can be achieved is by providing health education, or by providing education on various communicable and non-communicable diseases. When we educate the community people about various communicable diseases, how it is spread, how it is transmitted from one person to another, or how it can be controlled, only then people will have the awareness, only then people will realize what can be done, what is to be done and what should not be done. Education on control of communicable as well as non-communicable disease is also one of the major factors that helps in achieving community health. Another way of achieving community health is well-functioning health system. So for every community, for every society, we need proper healthcare delivery system. It will help the people to identify the diseases in the early stage, provide treatment and prevention for the diseases. Therefore, a proper healthcare delivery system must be present at a community level. The next way through which community health can be achieved is by establishing responsibility towards health. So as I said, community health, to achieve a proper community health, it is not only in the hands of nurses or healthcare profession. It is the collaborative effort of the people in the community and the healthcare professionals. Therefore, people should have, or they should develop the responsibility towards their own health. It is the role of healthcare professionals to make sure that people understand that they are responsible for their health. So establishing responsibility for their own health is also one of the ways through which community health can be achieved. So as I said, the first way through which community health can be achieved is by providing safe environment. If there is pollution in the environment, it may cause many diseases among the people in the community. Respiratory disorders especially occurs because of pollution in the environment. So a proper safe environment for the community people to live will help the people to achieve community health. So proper actions must be taken in order to prevent any kind of environmental pollution so that it does not harm the health of an individual, it does not harm the health of the community. The second one, as I said, is providing education on control of communicable and non-communicable diseases, which means without having proper knowledge, people will not be aware about how a disease is prevented or how a disease can be controlled. People will also not know about the treatment of the diseases. Therefore, education to the people in the community level is very much necessary to make sure people are aware about prevention and control of various communicable as well as non-communicable diseases. The third one, as I said, is well-functioning health services. Non-availability of health services or a non-functioning healthcare delivery system has a great impact on community people. Therefore, we need to have a well-functioning healthcare system within a community to make sure that people can reach out to those health services for any kind of treatment of the diseases as well as for health education or for medical purposes. If the health services available are not well functioning, then the morbidity and mortality rate in the community keeps on increasing, and therefore it will not let us achieve community health. The next one is, as I said, establishing responsibility for the health. Appropriate planned measures are required for the control, for the prevention of communicable diseases as well as chronic diseases. Communicable diseases such as chickenpox, mumps, tuberculosis, cholera, typhoid, and various chronic diseases or a non-communicable disease such as cancer, diabetes mellitus, stroke, and various heart diseases. In order to make sure that this disease does not cause harm to the community, we have to make sure as healthcare professionals that people are educated and people have enough knowledge regarding these kind of diseases. Therefore, it is not possible for us as healthcare professionals to provide community health or to achieve community health without the active participation of the people in the community. Therefore, we need active participation from all the members in the community so that they understand that they are responsible for their good health and actively participate in community with the healthcare professionals to help healthcare professionals achieve community health. One of the ways through which we can involving the family, individual, and community in planning as well as intervention of various community health related programs. That is it for today's class. So to summarize, today we have discussed about what is community, how can we consider a group of people as community, what are the various definitions of community, and we've also seen what is community health and what is our responsibility as healthcare professionals. In our next session, we will discuss about community health nursing, various aims of community health nursing, and community health nursing principles. I hope the class was helpful, and I'll see you all in the next session. Thank you and have a great day ahead.